Hi, my name is Rachel Patterson, and my Issues and Solutions project is over the nursing shortage. Currently, the baby boomer generation is retiring, and they're entering an age where they require an increased amount of health services. By 2029, the last of the baby boomers will have reached retirement age, resulting in a 73% increase in Americans 65 years and older. And the U.S. has the highest number of Americans over the age of 65, higher than any other time in history. Elderly people typically have multiple comorbidities requiring them to seek specialized treatment, and the population is surviving longer, leading to an increased use of health services. Many diseases that were once terminal are now survivable with long-term treatment, and long-term treatment adds strain to the workforce. The American Association of Colleges of Nursing project that 1.1 million nurses will be needed over the next 10 years to handle the increased volume of our aging patient population and replace the nurses who will be retiring. The United States has been facing a nursing shortage since before the pandemic, but the pandemic has exacerbated the nursing shortage. Nurses working in acute care have reported the highest level of job dissatisfaction. 24% of nurses are leaving the profession before the first year, and a nursing workforce analysis published in 2022 reported the largest drop in nursing in the last 4 decades. More than 100,000 nurses left the profession between 2020 and 2021. And a significant number of nurses who left were employed in acute care and under the age of 35. Nursing schools across the country are also struggling to expand capacity to meet the rising demand for care. The American Association of College of Nurses reports a shortage of nursing school facilities. The U.S. nursing school turned away over 65,000 qualified applications from nursing programs in 2023 due to insufficient faculty, clinical sites, classroom space, clinical preceptors, and budget constraints. In 2023, the International Council of Nurses released a report categorizing the global shortage of nurses as a global health emergency. The ICN endorses that protecting and investing in nurses is key to overcoming the nursing shortage. Contributing factors to the nursing shortage. A study by the University of Arizona asked nurses who left acute care within 2 years of starting the reasons why they decided to leave the field. These were the main issues: being overworked, feeling of working too many hours in a day with the 14 to 16 hour shifts. And they also spoke about issues with scheduling and feeling they didn't have a say in their schedule, insufficient staffing, work-life balance, the number of hours they were working interfered with their family time, management not providing proper support and not providing equipment needed to perform their job, as well as bullying by, the current medical staff. We've heard the phrase before, nurses eat their young. Also, workplace violence, emotional and physical abuse from patients and family members. Healthcare workers are at high risk of violence globally, with 8 to 38% of nurses suffering some form of violence in their careers. I wanted to touch on insufficient staffing. It's statistically proven by numerous studies a stable nurse-to-patient ratio is associated with better outcomes for patients and nurses, and higher patient loads are associated with increased hospital readmission rates, burnout, and high turnover. What are some solutions that can help with the nursing shortage? Well, providing additional support staff and improving staffing could help. Competitive pay, making sure nurses get sufficient breaks and time off, enhancing communication through direct staff engagement, increasing visible access support from management and leadership, and encouragement of nurses as professionals to improve quality of care and acting as agents of change. The American Nurses Association conducted the National Impact Assessment during the COVID-19 pandemic, and they found that nurses respondents from all clinical settings reported stress, bullying, and workplace violence, and over 50% of respondents were considering or planning to leave their nursing position within the next 6 months. These alarming figures in the survey caused the Kentucky Nurses Association to launch a statewide survey to further understand nursing perceptions and what supportive actions could help alleviate their hardships. This table was taken from the Kansas Nurse Association study, and a Likert survey was utilized to rate actions companies could take to help alleviate the shortage. So you see higher pay is on there, more nursing staff, the ability to influence decisions that directly impact the nurses as well as the patient care. Student loan forgiveness is one. Consistent availability of PPE, which we remember was definitely an issue at the beginning of the pandemic. The K&A survey also found that the most common non-financial action a company could take is to ensure the nurses feel valued, respected, and supported by their management. An effective practice to attract and retain nurses is for the hospitals to achieve nursing excellence requirements per the American Nurses Credentialing Center Magnet Recognition Program. And this is going to involve transformational leadership, practice at the highest standard of care, professional development and work culture, knowledge, innovation, and improvement. And will set a standard of nursing excellence that benefits the whole of an organization. Current efforts to address the nursing shortage. The American Association of Colleges of Nursing is advocating for federal legislation and increased funding for nursing education, promotion of nurse residency programs to aid in nurse retention, and the development of fast-track programs such as an RN to BSN and BSN to MSN to doctoral. There's also statewide initiatives in the different states being implemented across the U.S. For example, the University of Minnesota and Minnesota State came together to create a coalition for nursing equity and excellence, which will work with every nursing school in the state to expand equity in the workforce and increase student access. And different things are happening statewide in different states. What's kind of going on in your state, you probably should look into it. For example, I'm from Wichita, Kansas, and this summer the Ascension Via Christi Hospital combined with Wichita State University School of Nursing to create the Ascension Via Christi Wichita State University School of Nursing. And this is going to help support the new Wichita Biomedical Campus, and it's a joint initiative with Wichita State University, WSU Tech, and the University of Kansas to collaborate and support interprofessional healthcare learning. By strengthening connections between our classroom and our clinical setting, we can better prepare the next generation of caregivers who will serve the health needs of our communities for decades to come. And that was said by Kevin Strucker. He's the Via Christi CEO. In conclusion, we must address demographic shifts, workforce challenges, barriers to education, and healthcare system issues if we want to see a change in the nursing shortage. I would encourage you to reach out to your local state nurses association to learn more about what is being done in your area. These are my references. Thank you for letting me talk to you about the nursing shortage. Have a good night.